Let's get this show on the road. So, today we're going to be covering career development planning for students. Doesn't matter if you're a PT, OT, SLP, or nursing student, or some other form of student, a career development plan or a personal development plan, CDP or PDP, either one, you can kind of use them interchangeably sometimes. It's going to be super important because without that, you're going to lack guidance. You're going to lack clarity about where you're going. You could end up out of alignment with what you truly want to do and who you truly want to be. And that can cause some internal conflict. And we want to try to avoid that in all cases. So, the learning objectives for today are following this session, students will be able to define a career development plan. Following this session, students will be able to identify short-term and long-term goals geared toward achieving their North Star. We'll talk about that North Star in just a little bit. And then following this session, students will be able to implement a career development plan. By the end of this, I want you to be able to walk away with a plan that will work for you. So let's start off by just defining what a career development plan is. It's basically just a structured roadmap that helps students identify their career goals within the healthcare field of their choosing and outlines the steps needed to achieve them. Pretty simple, right? It encompasses self-assessment, exploration of career options, skill building, networking, and continuous professional development. So when you get into the healthcare field, you kind of sign up for lifelong learning, whether you like it or not. And that should never change, right? I'm 15, 16, 17 years into being a physical therapist. I've been a professor for last 5 years or so, last year or two, a senior learning and development specialist, and I'm still learning. I have a thirst for knowledge. I'm curious. That lifelong learner in me is never going to go away. And it's really served me well because I've learned some really cool things from some really cool people along the way, and wouldn't change it for the world. So stay curious, continue to learn. You can't stay stagnant. Otherwise, you're just not going to be as effective, and you probably won't be as happy and fulfilled. So stay curious and keep learning. So let's figure out this plan, right? Start with Why by Simon Sinek is a great book. If you haven't read it, I would strongly recommend giving it a read. It's worth it. Or if you drive a lot, commute a lot, get the audiobook, listen in the car. It's a great book. But essentially what it covers is how great leaders and organizations inspire action and create lasting impact, right? They start with the why. What's driving them? What's the purpose, right? What's the fulfillment there, right? And so when we kind of start thinking about our career development plan, we have to think about what our why is, right? I like to call it like your zone of genius, right? Your higher calling. What were you put on this earth for, right? Or your North Star, right? If my goal is to become the best physical therapist for quarterbacks at every level, from junior high all the way up to professional, if that's my North Star, if that's my calling, I am going to do everything in my power to learn and invest in myself and train and work with the best athletes and the best population to help me get to that level of mastery for quarterbacks in the nation, right? Everything I do is going to be centered toward getting me to that North Star. So, what does it look like? Why is it important, right? Well, it's an end game or goal, right? And if we reverse engineer all the way back on how to get there, that kind of gives us the pathway. And even if we don't become the Michael Jordan of physical therapists amongst quarterbacks, even if we're never the number one guy or gal in that position, if we keep striving toward a mastery of our craft and getting to that North Star, at the very least, you're going to learn a lot along the way, and you're going to probably hit a level of expertise and authority that's going to treat you very well throughout a career. So, why is it important to develop expertise and authority, right? Why is that even something we should strive toward? Well, it's been said, I think it was Malcolm Gladwell that says you need 10,000 hours at any given thing to become an expert in it, right? And that may or may not be true. The good news is there's a book called the Cambridge Handbook of Expertise and Expert Authority, or I think it's Expertise and Expert Performance. And it's a great book, but it's like a phone book. It is super thick. I would recommend maybe just Googling a summary or putting it through ChatGPT for a summary, unless you're super into those kind of books, and you really want to learn more about becoming an expert in authority. They use a lot of chess grandmasters as their examples on how they get better at strategy in chess. Um, it's a great read. I used it for part of my dissertation. But at the end of the day, what it showed is we can actually decompress that timeline to becoming an expert in authority to less than 10,000 hours, likely more in the realm of 5 to 7,000 hours. But it just takes practicing with intention, right? So whatever your North Star is, whatever you want to put your time, money, effort, energy into, it should be something that's you're passionate about, that's fun to you, that you enjoy, a population you like working with, right? Because it is going to take practice to get better at it, right? It is a journey. It doesn't happen overnight. So we might as well enjoy what we're doing and be passionate about it and have fun with it, right? That'll help keep us practicing and keep us learning and trying to get better at our craft and our skill. Otherwise, if you're not passionate about it, it doesn't fulfill you, doesn't, really light you up and excite you. When things get difficult, and they will inevitably get difficult along your journey, I promise. It's just life, right? You're just going to cut bait and bail. So we need to have this idea that we need to strive toward mastery. And even if we fail, we're going to get some good expertise and authority out of it, right? So establishing expertise and authority helps professionally because people end up coming to you as an expert in authority to collaborate on projects because they respect you. They appreciate what you have to say, your knowledge, your experience, right? I can't tell you how many papers and conferences I've attended and spoke at where people have come to me and asked me to be a part of it because of my expertise and authority in whatever the topic was they were presenting on. You can get clients this way, right? Patients will come and sign up for only you because they know that you are the expert and authority in the thing that they need help with, right? You easily can teach, guest lecture, right? Do other things in the community, educate the community, population health stuff on your expertise and authority. Plus, the better you get at your job, the more security you have, right? It's really hard to fire an expert in authority when they're just really good at what they do. There could be some personality conflicts and some other issues, maybe, but if you just get really good at what you do, you're going to have that job security. And then financially, again, you can command more from a salary standpoint, or, if you start your own business, you can command more as an expert in authority because you're one of the few people in the world that can solve their problem, right? You can charge more in patient care, right? Think about an expert surgeon versus family medicine doc, right? A family medicine doc comes in and triages and gives some meds maybe, and they charge, X amount of dollars per visit, and it's an 8 to 10 minute visit, and they're on their feet all day and they're seeing a lot of patients and they make a good salary. But imagine an expert surgeon who's been doing it for years, let's say brain surgery or neurosurgery, right? They only are in the hospital, maybe doing surgery 2, 3 days a week tops, and they're making 4, 5, 6 times more than family medicine, right? Because they have a skill set that takes a level of expertise and authority to even get to, so they can command more, right? Their service is more valuable because it's such a niche service and it's so desperately needed. And then again, you can command your value as an expert author or a speaker or, again, just a community educator, right? If they need people to come and speak to their group about something that you're an expert and authority on, you have that value and you can, leverage that for, either bringing patients in the door or just educating their group on something that you're an expert and authority in. So there's a lot of benefits to becoming an expert in authority and really working on this career development plan. So we have our North Star kind of figured out. It's okay if you don't, right? Especially when you're still in school, you're trying to figure out maybe I should just be a generalist, maybe I should specialize in something. It's okay to not have it figured out. But if you start to do some of these things, you'll start to get a more clear picture and figure it out, right? You really need to find what interests you and what lights you up and makes you excited about your career and the potentials and the opportunities that are out there for you in the career. If we take physical therapy, for example, you can become just a general physical therapist and treat patients of all types in an outpatient clinic or in a hospital and just see all types of patients in a hospital. Or there's separate sections or specialties that you can follow. So sports, aquatics, geriatrics, pediatrics, cancer, and oncology. There's a bunch of different specializations you can pursue in the world of physical therapy. So if one of them really interests you and lights you up, then that's where you should start your search and your investigation, right? Like start doing the research to see what it's all about and if it's still something that interests you. Even if you don't have it figured out by the time you graduate, that's okay. There's plenty of ways to figure it out while practicing and learning your craft and skill set and getting better at it in the real world. So, first thing we're going to have to look at is credentials, right? Do I need some form of credentials to do the thing I want to do? And for most of our healthcare students, yes, you will end up graduating and passing a board exam that will have, a DPT attached to it or an OTD or SLP or nursing, whatever the designation is, you will have credentials to then go forth and work, right? That's great. Do you need to add more letters after your name, right? Maybe, maybe not. Like I said, you may be a physical therapist, but you really love sports and athletes, so you want to specialize in that, and you're going to pursue sports residency after you graduate, and then maybe take the sports certified specialist board exam after that and add more letters after your name, right? And that could be something that interests you and something you may need for some positions, right? But some you might not, right? Is there a specialized training or certification you're going to need, or will just life experience and work experience be enough? If I was an athletic trainer for 10 years and then became a physical therapist, and then went into a sports rehab setting and facility, I may not need certain certifications or letters after my name because I had the 10 years of life experience as an ATC and saw all the injuries. So, maybe you need certification, maybe not, right? You just got to do the research and see. The next step we need to consider is our network. You've probably heard that cliche phrase, your network is your net worth. And that is very true. The people you choose to surround yourself with, the people that you collaborate with, people you have discussions with and are friends with, uh, colleagues and peers with, that all matters in the big picture. And the best time to start networking was 10 years ago, right? But the next best time is now. If you haven't started networking, that's okay, but today's the day to start. Research the people who are in the area that you want to specialize in or focus on. Follow them on social media, see what they're up to, right? Respond and interact with them, leave comments, read their stuff, whatever they're doing. Try to stay involved and see what they're up to and see if there's ways that you could maybe work with them or learn from them, right? What questions might you have for them? How do you get to the point that they're at? Like, how did they get involved in this specialty to begin with? That kind of stuff. Most of the time, people in healthcare are more than willing to help mentor you or, help answer questions or guide you and clarify things for you. They're really willing to help the next generation. So don't be afraid to reach out. Don't be afraid to ask. Just follow people, get to know them, like see what they're up to. There's plenty of social media platforms for that. LinkedIn is probably one of the best one for professionals. So start there and just start interacting and asking questions. Next, we're going to want to perform a SWOT analysis. If you've never done a SWOT analysis or heard of it, it stands for strengths, weaknesses, opportunities, and threats. And so when you're picking your North Star and your journey and your path to get there, you have to think about what are my strengths that are going to help me get there? What do I already have knocked out that will help propel me toward my North Star? Then, what are my weaknesses? Where do I lack? What do I have to get better at to make sure I achieve that North Star, right? What opportunities are out there? What can I do to better my position or propel me closer to the North Star quicker, right? And then what threats are out there? Like, is this something that's going to fade? Is it, like a league that's going to dismantle and the athletes won't need my help anymore? Is it that it's just become too political and you don't want to get involved in it? Like, what are the threats that are possibly out there for becoming the person you want to be and the expert and authority in your thing? Last but not least, we're going to need a map, right? It's easy to start a journey and start driving somewhere, but I would feel pretty unprepared if I didn't have my GPS, right, on my phone or my map. Um, if I were just to try to drive from Austin, Texas to Miami, Florida, could I get there? Probably, but I'd be a lot more certain if I had a map and a GPS, right? So we need to map out what this is going to look like, right? Our timeline, how long we think it's going to take, right? What are the rules of engagement? What are the steps that we're going to need to take? So again, if I was looking to become the best quarterback physical therapist in the world, I would say, okay, it's going to take me 3 years to finish my DPT, probably 1 year worth of residency and sports certified specialization. Then I take my board exam a couple months after that. Then I get a job and work for 3 to 5 years in a sports rehab setting. And then I fine tune my skills and start maybe my own business helping specifically quarterbacks, right? Like that's what the timeline is going to look like. I know the steps I need to take, the boxes I need to check, the certifications and specializations I need. And now I just need to start getting them done, right? So you've got this plan laid out. Now what? Well, you found your North Star. You've got your why, what lights you up, and what your passion is, right? You found that zone of genius that people come to you for, they ask you questions about, or they just go to you because they know you're the expert or you love it so much or you're so knowledgeable about it, right? Next, we need to reverse engineer the steps in the plan to get to that end game. Like we talked about, we need our map, right? We need to map out how long it's going to take and what the steps are at each one of those phases, right? Now we need to implement. We need to go do the things and check off the boxes, right? We need to study for our exams, do well in school, get all the knowledge, pass our board exam, apply for the residency, go through the residency for a year, get a job, work, do all the things, right? We need to start implementing our plan and accomplishing and checking off both short-term goals and long-term goals. And I would recommend using SMART goals, right? We use them for our patients. Well, guess what? I use them too as a professor, as an educator. I still use short-term goals and long-term goals as SMART goals because they work. So figure out what your short-term goals are, and it may just look like study for 7 hours this week on this course for this exam at the end of the week. Great, that's a short-term goal, right? A little bit longer. All right, by the end of the semester, I want to have, A's in all these classes and B's in these classes and be prepared and ready for the next semester when I graduate, right? What else do I need to do short term, right? It may be something just like start networking and reaching out to people in the sports community and rehab community so I know what they're doing and what that looks like, what the community looks like, and interacting with them, right? Then long term goals would be like, all right, graduate with my degree, take my board exam and pass it, get a job, work for 3 to 5 years, honing my skills and crafting my skills, right? So short term goals and long term goals using the SMART goal format, right? Specific, measurable, attainable, right? And then I can't remember what the R is for now, but the T is time based. Um, and so just make sure that you're setting goals that make sense for you and your plan and what you have in mind for the future. Because if we're setting broad goals that don't really matter or won't come into play, then we need to make sure that there is some sort of meaning behind it, right? Because otherwise, you can achieve goals, but they're not going to move you forward, right? related are the R in SMART goals, relatability. So make sure that again, it's attaching to what you're wanting to do, and it's going to move you toward your North Star, not away from it, right? Now, along the way, you're probably going to hit some barriers, some bumps, some bruises. That's okay. That's part of the learning process, right? But we need to reframe and start thinking about our mindset a little bit differently and realize when something bad or negative happens, not why is this happening to me, the victim mentality, right? But why is this happening for me? Right? Why was I meant to go this path? Maybe I needed more time. Maybe I needed to learn more. Maybe I need to make my resume more appealing. Maybe I need to have a better skill set and improve my skill set to be more competitive, right? Start thinking about, the opportunity in learning through failure. Failure happens. It's okay, right? What can we learn from it? How can we get better from it, right? Change that mindset. And then, as always, think about the outcomes and the possibilities, right? Prepare for the worst, but expect the best, right? If I apply for the sports residency, and I get it, great. Best case scenario, I'm going to get good at sports. I'm going to take my certified specialist exam, I'm going to pass it, and I'm going to have the next part of my journey lined up and ready to go. Worst case scenario, I don't get into the sports residency. What happens now, right? Well, I take a year and I work or I do something sports related and then apply again the next year when my resume may be a little stronger, my application may be a little stronger, right? What are three or four other things I could do in the meantime to get my skill sets up, right? To start gearing towards that sports residency, right? Just always thinking about what could possibly happen, and if it does, what could that look like? So now we've got this big picture, convoluted plan, right? We've got our big North Star goal. We know that we need to seek out some mentoring. We need to start networking with the right people, right? We need to improve our training and our skill sets. Then we need to look at professional development, right? CEUs, continuing ed units, courses, things that can help elevate my skill sets. And now what, right? Like, how do I make sense of all this and tie it all together and make it nice and smooth, right? Well, we start this professional development plan or this personal development plan or career development plan because there is a why to this, right? There is a meaning to this and it's helpful, right? One, it increases retention, right? It increases your ability to stay focused on the thing and stick with it over a long period of time, even when times get tough, right? And it helps with just keeping you in the situation or setting you're in to accomplish the things you need to, right? It re-energizes you, right? Every time you look at your plan and reassess it and address it, I look at mine every year. But every time you do that, it improves the chance that you're going to still love what you do and come at it with different new re-energized visions of how you could accomplish and how you can get there with new ideas. So it keeps things fresh, it keeps you motivated, right? It provides more control in planning your path. If you just say, well, I'm going to graduate and wing it and see how it goes, might not be as effective as if, hey, I've got a path, I've mapped it out, I know what I need to do. Now I just have to implement and follow through, right? It also provides leadership skills, right? It could also provide a mentor for you, and it gives you as the individual a concrete way to identify opportunities and goals. Like we talked about the SWOT analysis. If you lay this plan out and you stick to it appropriately, you'll see your strengths, your weaknesses, the opportunities that are out there, the threats, right? You'll seek out a mentor through networking and through asking the right questions and finding someone who can help guide you and kind of shepherd you along your path, right? And then the leadership skills of just doing this, creating this plan and following through with it, that shows initiative right there. That shows leadership. So it's important that we start with this plan and we start kind of figuring it out and really making it clear and concise and to the point so that we know exactly what our directives are and our initiatives are to hit those goals, both short term and long term, and accomplish our big vision North Star. It also improves efficiency, right? Because if you have the plan laid out, you know the check boxes you need to hit. Yeah, occasionally one or two new ones may come up that you weren't aware of or didn't know about, but for the most part, you're not going to spend time going all over the place and looking for a course to take or a random, meeting with somebody who has no idea what you do or what, field you're in. Like you can narrow things down and be more efficient in the type of patients you see, the type of people you network with, who you surround yourself with, the actions you take, the courses you take, right? We're more efficient, again, squeezing that timeline down from 10,000 hours to become an expert in authority to 5 to 7,000 because we've practiced with intention. We've improved our efficiency. We're getting better quicker. And then last but not least, just weighing out the opportunity costs, right? If I don't do this, if I don't map this out, if I don't come up with a plan, how long is that going to delay me to getting where I really want to go? How much money will it cost me in the long run because I wasn't doing the thing that I was meant to do at my highest level and being able to command the value I'm worth? Right? Those are the things we need to start thinking about and why this is so important to get this dialed in and really come up with a plan that works for you, right? Figuring out the training I need, the mentoring I need. Do I need to change up my surroundings and get in a new setting or, surround myself with other people doing things I love that are really good at it, right? Do I need to take CEU courses? What other resources might I need? These are the things we need to consistently be asking ourselves year after year to really develop this plan and map it out. So here's a couple of quick examples. This is just, generic made up students to new grad to then seasoned vet, right? So this could look like a DPT student's career plan, right? Year one, they want to complete their first clinical affiliation, right? Do their first clinical rotation. They want to attend one conference by the end of that year. And then they want to just become an APTA member, right? Pretty simple first year goals, right? Nothing too wild or crazy. Um, the 3 year goals are a little bit longer term goals. Maybe they finish PT school by then. They've identified a practice area they want to specialize in, right? They've achieved their first position as a PT, right? They got that job. They graduated, passed their board exam, got their job, and they've started to grow their network, right? They've reached out to people in the field that they want to practice in and focus on. They're interacting with people who are doing the thing that they want to do, and they're actively seeking opportunities to collaborate or work with these people or learn from these people, right? Now we look at the new grad, maybe 2 or 3 years out of school. They've been working for a little while. Maybe they started as a generalist, but now they know what they want to do and they want to specialize, right? They're going to create or revise their career development or personal development plan, right? Again, I revisit mine every year and update it. So if they haven't done one yet, now would be a good time. If they've already done one, then they just need to revise it and fine tune it and tweak it to make it still be in alignment with their North Star and what they're trying to accomplish, right? They maybe have a mentor now. They've been working with somebody on their clinical skill sets within their area of specialty, and they're getting better. They're asking the right questions. They're meeting regularly with their mentor, and they're starting to assess their knowledge gaps. So I've been at this 3 or 4 years now. I'm getting pretty good at it, but I noticed this, and this still need to be elevated. I need to work on those skill sets. I don't know enough about them to get good enough at them. I need to take some sort of course or something, right? From a 5 year plan, longer term goals, right? Maybe they complete a certification, right? Maybe they study for, a year or so and don't go through necessarily a residency or fellowship, but they study for a year, they get better at their specialty, and then they sit for the board exam, right? Um, Maybe they finally decide that, hey, this is the field I want to go into and specialize. Maybe it's pediatrics. So I want to try to load up my schedule with just pediatrics patients as much as possible, and I'll help bring those pediatric patients in for the clinic so that I can see more of them and get more reps under my belt, right? And then last but not least, the seasoned vet who maybe has been out 5 to 10 years, right? And is now looking to their next phase of life, right? So the first year, maybe they start a new business. right? They're like, you know what? I've been doing this a while. I think I want to go out on my own, start a new business, right? And they've been in it for a while now. They've got the expertise, the authority, the network. So maybe they decide they're going to run for an APTA position. Maybe it's at a state level, maybe it's at a national level, but they're ready to give back to the profession. They have a lot to share. They've learned a lot. They want to give back. Maybe they identify a younger mentor, right? Somebody who's younger than them, but really good at tech and IT and AI stuff, and they're not. And they're like, hey, I could learn from you, even though you're younger than me, right? Maybe they have their older mentor too, and they're helping, getting learning from them and mentoring from them. But now maybe they feel ready to give back to the profession. So now they're seeking a younger mentee that they can help coach and get them interested in their clinical field or aspect, right? And then their 5 year plan. Okay, well, I started my own business, took about a year, got it up and running. Maybe I want to expand the practice. Maybe I want to grow and scale it to 2 or 3 clinics in 5 years, right? Maybe I want to start teaching more. Maybe I want to attain like a faculty position as a contributing or an adjunct faculty, right? Again, these are all just examples of what a 1, 3, 5 year kind of plan looks like for somebody at a DPT level or a new grad level or a seasoned vet level, right? So we have this plan, we have this idea of what it's going to look like. Can be a little sloppy, can be a little messy, right? But from graduation, the earlier you start this plan, the better you're going to be prepared once graduation happens and you actually have to go out in the real world and start navigating this really messy plan that's ahead of you in this roadmap, right? You can refine it, make it what you want, center it around your North Star, your zone of genius, and just start working on it little by little. It's not going to happen overnight. It can change. There can be winds in the road and pivots and twists that you can adapt. That's okay. Um, these are just some of the resources here that we use for today's presentation. Again, Simon Sinek, Start With Why, the Introduction to the Cambridge Handbook of Expertise and Expert Performance. Like I said, it's a great book, great resource, but it is a beast. It's a phone book. So if you don't have spare time, I wouldn't pick that one up for leisurely reading. And then last but not least, How to Develop Your Healthcare Career by Taylor. That one is a good one for creating a plan and a map for your professional career. I'm going to share with you a template that I use for my annual career development planning. We'll stop sharing here for a minute, and I will bring up my plan. And again, you can create your own. You can Google just, career development plan or personal development plan, or put one in through ChatGPT and have them come up with one for you. But this is just one that I use so you can see what it looks like to kind of ask yourself the questions and guide your way through. All right. And so again, I put my name here, the date that I initiated. Usually it's January of each year, so I can do it at the beginning of the year and then rethink about it at the end of the year. And then my current title or job position, right? I try to reflect on the past and assess where I'm at now, right? What have I been doing the past 1 to 5 years for professional development? What accomplishments am I most proud of so that I can celebrate those, right? And give myself a little pat on the back. What barriers have I faced in the development? What do I need to work on still? Maybe some weaknesses or threats, right? Is this where I plan to be at this stage of my career? Am I on path? Am I getting all the right check boxes? Am I still progressing? What value do I now bring based on all the things I've done over the last few years, right? Where do you find yourself not being fully present or engaged at work? This could be opportunities to improve or become more interested or learn more about something. Um, and then how does work connect with my values? That's a big one for me because being in alignment and doing the thing that I know I'm passionate about and love to do helps get me in alignment and lights me up and inspires me and keeps me moving on the path toward mastery. Next section here is just why am I here, right? Like what made me choose this profession? A lot of us get into healthcare to help people, right? Well, that's great, but dig deeper than that. What's more than that? Again, if we use our quarterback example. Well, I got into this profession because I was a quarterback in college and I hurt my knee and I went through PT and it was the best experience of my life. I loved my PT. I got better. I ended up going back and finishing my senior year. Had a great year. And I wanted to do that as well. I wanted to help people, but specifically, I wanted to use my knowledge and my injury and my story and my rehab to get quarterbacks better because that's who I was. That's part of my identity. And I want to give back to that group, right? So we look here next at the area that we can work on in the assessment, right? So what are my strengths, talents, gifts, or special skills, right? And how am I assessing those or looking at those? Where are my areas for development, right? How am I coming up with those and what am I going to do to get those? What are my knowledge gaps? Where do I still need to work on? And then what have I accomplished, right? What are some things that I got done on my checklist? Next, I'm going back and re-looking at my vision, right? What is your vision of your future career? And for me, I'm still on the same path toward my North Star. That hasn't changed at all, right? Um, and really start to hone in on your specific career goals. What do you want to accomplish over the course of a career, not just this year or, get a job as a PT? Like, what do you want your career, when you look back at retirement, what do you want to have accomplished, right? And then it's important again that you don't rush, that you take your time to think through these things because they're important. They're going to drive your life and your career, right? So again, I start to think of short-term and long-term goals here, right? 1 year, 3 year, 5 year, and for the short term, you can even break it up into quarters. I like to use quarterly goals for my 1 year, so 3 or 4 quarterly goals, and then my 1 year goal for the one long-term one. Next, I kind of look at my long-term vision and what that's going to look like from a goal standpoint, right? My short-term goals to get me to the long-term goal, some of the keys to success, right? What I'm going to need, what I'm going to have to pull in to be successful at achieving those goals, work I need to do still to make sure I'm prepared and moving in the right direction, actions I need to take, right? Do I need to sign up for a test or a CEU or a course, or do I need to set up a meeting with somebody, right? Like the actions I need to take to accomplish these goals, and then when will I complete them by, right? So kind of using the SMART goal format there for these. And then last but not least, you have to go back and evaluate your plan, right? Because it's a process. It's not just like set it and forget it and I'm done. All right, I did my plan. I'm good, right? My career development plan is all good. It's in the back. If you don't revisit it, if you don't update it, if you don't continue the process, it's never going to be effective, right? So share your goal, share your plan with a mentor or somebody who you trust, who knows you well, right? And I like to consider sharing mine with a mentor of mine, both internally and externally. So somebody who works with me in the company or outside. This way, I have an external point of view as well. Try to determine the evaluation frequency. Again, for me, it's quarterly for like short-term goals, but those are like mini check-ins for the big 1 year long-term goal. And then I also, at the one annual review for myself, I look at the 3 and 5 year goals to make sure I'm progressing toward those as well. Do I need to pick up the pace? Am I falling behind? Or no, I'm good. I'm right on track. Um, and then also consider the applicability and ease of doing this and accomplishing the things you need to do, right? If getting an extra degree after you graduate is something you want to do, but there's no time to go to class because you're working full time, right? Can you really apply? Can you do that? Well, maybe is there an evening school or is there an online school I could do for it, right? You need to kind of consider those things. What are the barriers, right? What are the opportunities? Again, going back to that SWOT analysis, every time you come back to this career development plan and review it, do that self SWOT analysis every year because it's going to be helpful in becoming a better version of yourself so that, again, you can navigate the way to the best possible version of yourself to get the outcomes that you're trying to get. And then last but not least, kind of measure your progress. So again, monthly revisions if you need. I like quarterly, and then annually for the big long-term 1 year goal, 3 year, 5 year. So that's my plan. You can come up with your own. Again, this is just the basic template that I like to use every year. I fill it out, I share it, and I check in with my mentors and just kind of see. I like to use my mentors for this check-in as well because it's accountability. And so it's important that you have some accountability. But again, if you have a plan and you're implementing it, you're following through on it, you're going to be way further ahead of the game than the average clinician who graduates and then just goes out and starts working because they got a job because they needed a job, right? You have to practice with intention in anything you do, whether it's getting your skills set up clinically or whether it's your career goals and getting those, better, your personal development stuff. You have to practice this stuff with intention because not only will you get better at it, but also the timeline in which you'll get better will decrease tremendously. So, I hope that was helpful. If you have any questions, feel free to email me, ffeil at usa.edu. That's ffeil at usa.edu. Happy to answer any questions. Happy to take a look at your career development plan. If you want to put one together and meet up with me to show me that, I would be glad to go over it and review it with you. But best of luck in all that you do and get that North Star figured out as soon as possible. It can change, you can pivot and stuff, but the sooner you know how you want to make an impact in the world and really help people, the better you'll be at career planning and developing and getting a true map to get there. So, hope that helped, and we'll see you guys on the next one.